Hello everyone, this is Dr. Piyush Dubey, and today I'm going to place a central line catheter for a dog that has renal failure, and we are going to do hemodialysis after fixation of this central line catheter. So before starting, I'll just show you what the central line catheter is like. So this is a central line catheter. So this is a main catheter that goes inside the vein. These are the two dilators of the vessel or the vein. This is additional a blade given for giving a nick. This is needle that will go inside, and inside this needle we'll have this guide wire to guide our catheter. So this is our central line catheter that we are going to place. So now the landmark for placing the central line catheter in a jugular vein is this jugular furrow, and how to measure the size of a catheter required for the dog. So the basic idea here is that uh, the catheter should reach to the atrium so that you'll get a good flow and it will not be a block. So you have to have an appropriate size of a catheter in which it should go to the atrium. And how to measure the size of a catheter? So there's a trick here. When the animal is on a lateral recumbency, you have to push इसका पैर को सीधा करो. You have to first take this leg and flex it behind, and where this elbow is coming up, from where this elbow is coming up, so this is a place where the atrium is present. So you have to measure from a scale that how many centimeters this length is, and that length catheter is required. So if I'll ask my attendant to measure it, यहाँ से यहाँ तक करो, just take यहाँ से यहाँ तक. So this is a 30 centimeter scale, and यहाँ तक 30 centimeter आ रहा है, और उसके आगे फिर लेके आओ स्केल को. स्केल मेरी उंगली है यहाँ पे, हाँ. And roughly from here to here it is like 5 centimeter. So we required 35 to 40 centimeter of a catheter size. इसको हटा लो. For this dog, it's a Saint Bernard, a huge size Saint Bernard, but his body weight is around 40 kgs only. So this is how you're going to measure the length of a catheter. So let's start with the procedure. So I'll first take this needle, and this is a jugular. We have already prepared the site for placing the catheter. We have sterilized the site. So this is a needle that we are going to place in a jugular vein. So this is a distended jugular vein that I can able to see, and here I will just put needle, and you can see the blood is coming up. So I will now take my guide wire, and I will put it inside the vein. So here this guide wire went inside the vein, and it will go till hard. Now I'll remove. Can I have some gauze piece, please? I'll have to remove this needle. Before removing the needle, what I'll do is I'll give a small nick here in the skin, just to made a space for a vessel dilator to go in nicely. So I've just made a nick here, and then I'll place a watch piece and I'll take out the needle. So here it is. I'll ask my attendant to press this. Now we have a two dilators here. So first the narrow one should go inside, and then this broad one will go inside. But his vessel is large, and I'm confident enough to place this broad dialyzer on the first attempt. So I'll go with this. I'll push back the guide wire a little bit. So here it is coming out, and now I'll have to give a nick, a little bit. Yeah. Okay. So now just going nicely inside. I'll give 2-3 pulls to make it free. So now this is freely moving. Now I'll ask my attendant again to press this so that the blood will not come out. And here it is. So we have already made a hole in a vessel, and we have manually pressing it up so that the blood should not come inside. So now this is a catheter that we are going to place in. It's a 35 centimeter 12-inch central line catheter. We have already pre-filled this catheter with cath flush. Cath flush is a heparin that we are using for flushing this catheter so that there may not be any clotting. And as it is a large catheter, I'll pull back the wire a little bit, and I will pass the guide wire and this guide wire is coming out and with the help of an artery forceps I'll secure this so that it may not go back. Now remove this. I'll simply place the catheter, इसको खोल दो, and simply push the catheter inside, and it will go directly till the atrium. Now I'll gently remove this guide wire, and you can see the blood is coming out. I'll have heparin again. Can I have heparin again? एक नया कैथ फ्लश खोल लो थोड़ा सा. So this is a syringe. I'll see the patency of this catheter, whether the blood is properly coming out or not. See, the blood is coming out. I'll lock this up. I'll see this patency of this loop as well. See, it is coming. The blood is coming nicely. So this indicates that our catheter is placed in a right position. I will add, give me this. I'll again flush it with approximately 5 to 8 ml of heparin. That is a cath flush. Cath flush heparin is a diluted heparin that is used to flush the central line catheter. So here we are flushing it, and I'll lock this, and again I'll flush this side, and I'll lock it. So now this is locked. We have this knobs to close the catheter. So we have these two knobs to close the catheter. And now I will fix the catheter with the help of suture, which is provided in a with this एक scissors देना मुझे. With this catheter set. So here we are. Now our idea is to place the catheter, in such a way that it is always pulled towards the heart. So for that, what I'll do is I'll take suture from behind this. एक वो देना मुझे forceps. So I'll take a skin from here and like this, and I'll lock it up. I'll repeat the procedure from here. I'll take the skin and I'll this is how I'm going to fix it. To give an extra security, I will put suture, new suture over here, like this, and I will lock the catheter over here. So this is how we have placed our catheter. And before closing it, I mean, we have to pack it with the gauze piece, as well as we have to wrap it all around the neck, so that we can make it firm and make it comfortable for the dog. And this catheter lasts for approximately 2 months, and if you care it properly, and the care required is regular flushing. Whenever you used it, before closing it, you have to flush it with a cath flush or a heparin, so that it should not block. And I'll going to do an X-ray just to see whether my catheter has gone exactly on a position that is required or not after this video. So thanks for watching, and take care of yourselves, and we will try to live stream some more procedures soon as possible. Thank you. किसका मैसेज चैट आया था?